I'm Dr. Michael Newman. I'm a board-certified plastic surgeon. I've got offices in Beverly Hills and Torrance, both locations in Los Angeles. When a patient comes in asking about breast augmentation, we really want them to know about all the options. And so we'll do an examination on their body, but then we'll also show them all the different implant types, all the incision options on top of the muscle, under the muscle, so that they know every choice that's out there. But what we find is a lot of patients get overwhelmed with all of these choices. And so after we examine them, then we can say, well, based on your anatomy, these are the best choices that we recommend for you. And so that very tailored approach, I think, is part of why patients really appreciate coming and seeing us. When people are coming in for breast augmentation, implant choice is a big part of it. And typically, a lot of patients end up asking, well, what do most people do? You know, I'm confused with all these choices. Which one do most people select? Or they'll ask, well, which one would you recommend to your friend or your family member? And I ultimately give different answers to those questions. So the most common choice in our practice is silicone. Silicone is probably 75% of the implants that we put in. But then there is a subset of patients that decide that they want the safety of knowing if their implant is ruptured. And so for those patients, we talk about a water-filled implant. And my favorite saline or water-filled implant is the structured ideal implant. And so we definitely recommend that to patients if they're asking about what I would prefer for my family member or my friend. But we also want to give them the choice so that they don't feel pressured in any way. They should be making the choice that's best for them. And so specifically when it comes to ideal, the concept of knowing about a rupture is probably the most valuable aspect of the implant, because it is water filled. Once it breaks, which all implants eventually do, then there's a known rupture versus a silicone implant where you might have a silent rupture, a broken implant that you don't know about. So really that safety aspect is very inviting, very intriguing. But in addition, what we've seen now over 10 years of having ideal implant data is that ideal implant really offers the lowest risk as far as complications. And the data shows that, you know, the lowest risk of things like capsular contracture. And that is a really concerning element for us. And of course, the lowest number of rupture rates as well. So those low complication rates are really what make ideal very attractive to me and something that I would be happy to brag about to my colleagues. I use a lot of ideal implants on breast augmentations. I also use a lot of silicone implants. And it's interesting, when I have patients come back to the office for follow-up, I often will not be able to tell the difference between a silicone implant or an ideal implant. Even with looking at the result, palpating the breast. And so I will often have to go look at the chart and say, gosh, what implant did I use? And so I definitely think the ideal implant offers a very soft and natural feel, as well as a very natural look. And so I find that our patients are really happy with that result. We are fortunate in our group to be able to offer the ideal implant to patients. And we're very excited to have that available because it offers so many advantages. And those advantages include things like a very low capsular contracture rate, a very low rupture rate, no silent rupture, an incredibly natural feel and look, and tremendous satisfaction from both patients and physicians. And plastic surgery is just so fascinating. You know, it was fascinating as a med student. That's why I chose to do it, because it was just so inspiring to see a transformation happen before your eyes within a few hours. You know, things that you couldn't even imagine would just metamorphosize there in front of you. And so being a part of that transition and making a difference for patients was phenomenal.